Hello everyone, this is Dr. Shishma Sarila, consulting homeopath at Fidicus Women. Now coming to the health complications in PCOS and PCOD. If you take health complications in PCOD, I've told you that it doesn't do a lot of harm unless it is very chronic in nature. Remember, PCOD is also harmful, but you have to understand that it should be chronic in nature, and in people who have a genetic history and in people who have really bad lifestyle, that is improper sleep, a lot of stress, can go into really bad state of PCOD also. So that is also a risk factor. But in starting stages of PCOD, it doesn't do a lot of, it doesn't affect your body too much so as for you to have other symptoms for the organs. If you take PCOS, it's serious in nature. It hampers your insulin. It plays with your insulin. It plays with your thyroid, leading to hypothyroidism, type 2 diabetes, which come after the insulin resistance, high cortisol level, and then you might be having dyslipidemia, you might be having high androgenetic index, and you might be having, you can be prone to high BP, that is high blood pressure, and also that is hypertension. And then you can also be exposed, or you can also be prone to endometrial cancer as well. So PCOS comes with a lot of baggage. So if you're someone who's suffering from PCOS, you don't have to worry that you will be getting all of these diseases. It depends upon your genetic makeup and your lifestyle also. So make sure if you are a PCOS patient to contact doctor as soon as possible. And then we have emotional impact. How does PCOD and PCOS play with the emotion? In PCOD, many people don't even experience them. Some people do experience them. It doesn't mean that if you're having mood swings that you're having PCOD. It doesn't mean like that. Some people do have a lot of fluctuations naturally also. So even though if you're suffering from mood swings just before your period or during your ovulation, doesn't mean you have PCOD. It just is that it's a coincidence, or you can say that's a common factor between PCOD and normal people also. They will experience certain mood swings, especially 1 week before periods, but the mood swings are not too much that they can't handle. Whereas in PCOS people are more prone to anxiety disorders or panic attacks or depression. Even if you're seeing a small Instagram reel which is sad or which causes you to get this, weeping kind of tendency, it triggers that weeping tendency. All of that is present in PCOS. Suffering from PCOS also have this depression alongside anxiety also, because they have hard time losing weight. They try different things, they don't lose weight, they get frustrated, their skin starts to become dull, the acne start popping out, skin becomes very oily, hair starts falling down. So all of these are associated, and especially women are very concerned about how we look, right? So that will be affected. They are more prone for anxiety and depression rather than PCOD people. PCOD people might experience mood swings, but they experience clinical symptoms of anxiety and panic attacks. Now coming to reversibility, we'll see how PCOD and PCOS, if they can be reversed or not. PCOD is completely can be reversed. It is reversible in nature. If you're taking good medications, following diet, doing your workouts regularly, you can reverse it in 6 to 7 months. But it also does depend upon the cyst size and the number of cysts. Usually it is completely reversible. You don't have to worry a lot if you're someone who's experiencing PCOD symptoms. But people who are experiencing PCOS should be a little bit careful, because they need long time treatment, they need long time medication, they need medication for diabetes, they need medication for thyroid, they need medication for hormonal fluctuations, they need medication for ovulation, they need medication for this mood swings, they need medications for their skin improvement, they need medications for their hair fall. So there's a lot of things attached to PCOS. So it under proper conditions, given the timeline or time frame, it can be highly manageable if you're following certain instructions. Okay, and in some people who follow the combination of homeopathy, diet and workout, it can you can manage the symptoms, the cyst size can decrease, and on a longer run you will be completely healthy. Now coming to the long-term risk in PCOD and PCOS, PCOD doesn't present with a significant risk, whereas PCOS can present with diabetes, cancers or heart diseases also. Coming to the severity, PCOD is less severe compared to PCOS, because PCOS, it is a syndrome, right? So it has a lot of other organs which are affected by this PCOS. So it is more severe compared to PCOD. Coming to the consultation options, here we have seen why homeopathy is important. How we have seen homeopathy is much better than allopathic form of treatment, and in homeopathic form of treatment, we suggest you to choose Fidicus Homeopathy. At Fidicus Homeopathy, we have two kinds of consultation options. One is online consultation, the other one is offline. If you're someone who's staying nearby the nearest branch of Fidicus, you can come and contact us in person. But if you're someone who's staying away from us and you would like to get in touch with us, you can call us either to audio call or you can connect us to the video call. After the doctor consultation has taken place, we will be asking you for investigations, and once the investigations are reviewed, especially to online clients, we will be sending you our medication. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days, and if you're staying across the globe anywhere else, it can take 4 to 8 business days for our medicines to reach your doorstep. If you're someone who's experiencing PCOD or PCOS or any female reproductive organ diseases, you can contact us on this number, which is given here. You can call us, you can WhatsApp us, or you can message us on this number. And if you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's experiencing PCOD, PCOS, or any female reproductive organ diseases, try choosing Fidicus Homeopathy. Why is Fidicus Homeopathy much better option? We have seen how homeopathy is much better option than allopathy. Now we are going to tell you how Fidicus Homeopathy is much better option than any other homeopathic clinic. Because Fidicus Homeopathy stands for highest chance of health. Here we have already having good or high success rate with people who are suffering from PCOD, PCOS, endometriosis, adenomyosis, bulky uterus, and fibroids. Apart from that, we have transparent treatment, which is there is no gray area between the patient and the doctor. We will be clearly telling you about your prognosis. And the third thing, the personal care here at Fidicus is top notch. The reason why we are doing the video is because we are having a lot of patients who are asking a different questions. So we just thought, like, if the patient who is coming to us is asking these many questions, what if some people who are not expressing how they are feeling or what they have and they do not even know if they're suffering from certain diseases. So we wanted to do educational videos on that. So we are doing these videos based on the personal experience we have had with our patients. So here at Fidicus, the personal care is top notch. Even if you're having some sort of queries or if you're having any sort of doubts, we will be clearing that to you. So if you want to choose health, if you want to choose proper cure for your diseases, choose Fidicus Homeopathy. Thank you.